Welcome to the Bidders Conference for the Veteran and Family Counseling funded through the Veteran Seniors and Human Services Levy through the strategy of healthy living. We'll go through what all of that means. But first, let's go through a land acknowledgement. Something that we do with all of our RFPs and indeed all of our meetings is acknowledge the land on which we stand, the history that came before us, and that we would like to honor, respect, and live up to the traditions of the native tribes, the coastal Salish, past and present, and honor with gratitude the land itself and our opportunity to be here together. So take a moment. And now we'll get into introductions. Again, my name is Gretchen Bruce. I'm with the King County Department of Community and Human Services, the Veteran Senior and Human Services Levy, the Adult Services Division. My preferred pronouns are she and her. I am the coordinator for this particular RFP. I typically oversee the contracts that are funded with our community partners, funded through the veterans stream of the Veteran Seniors and Human Services Levy. If we can go into introductions of who else we have on the conversation with us. I'm going to call on you as I see your names here. Cassandra?
Okay, it took me a minute to unmute myself. I am Cassandra Jackson. I'm with Sound, and I'm the director of our South region.
Okay. Kathy?
I'm Kathy Basalin. I'm the CEO of Easter Seals Washington, and my preferred pronouns are she and her.
Ethan?
I'm Ethan Soraka, the Director of Whole Health and Innovation for Sound.
For Sound, okay. Can you spell your last name?
It is Seracka.
Okay. Joelle?
Hi, I'm Joelle Blair, and I am the Regional Director of Eastside for Sound.
Sorry, you cut out at just that moment. With who?
Sound?
Sound.
Yeah.
Got it. Melissa?
Hi, this is Melissa Rowe. I am a program specialist with Washington State Department of Veterans Affairs.
D. Lockman? D. Lockman? Still on mute. Okay, well, we've got D. Lockman with us. And Parsh?
Hey everybody, my name is Parsh Vivishi. I'm from the Headstrong Project. I'm a program manager there.
Okay, great. Thank you all for joining us. From time to time, we may get a little sign here of someone waiting in the lobby. I'll take a moment to let that person in if that shows up. Okay. What we'll cover today is what is the Veteran Seniors and Human Services Levy, an overview of this particular strategy, which is all about PTSD and end-of-life counseling, along with military family counseling. An overview of the RFP itself, and talking about what are some of the highlights and the special areas of emphasis, and how that was informed by community feedback. And then we'll go through ZOOMGRANTS, what you might need to know about applying in ZOOMGRANTS, and again, questions and answers so that we can record this and make it available to anyone who might not be able to join us today, but can benefit from the insightful questions that you all might ask, being able to show some of the things that needed additional information. 1 second, I'm getting my laptop or my keyboard plugged in. Okay. The Veterans, Seniors and Human Services Levy, VSHSL, or sometimes VSHSL, if you hear us call it that, was passed by the King County voters in 2017. It is a 6-year property tax through December of 2023, and it generates 10 cents per $1,000 valuation of real estate property. It brings in about 55 to 65 million annually. It is the third levy that our voters have passed in King County to support and honor veterans and human services. This is the first time around that it also included seniors as a dedicated funding stream and population to be served. In 2018, we passed, or the King County Council passed, an implementation plan which guided the investments of the funds and with specific designations across 5 strategy areas, saying that these are some of the core things that people need to be healthy, thriving, and strong community members in King County. We know that everyone needs stable housing. People need financial stability and financial resources to be able to afford the things that they need on a day-to-day basis. We all need social engagement, and that has become very evident, ironically, during this time of COVID. As we are sheltering in place, we are all learning the importance of having connections, relationships, and people in our lives that help us feel more connected to the world around us. We need healthy living, both physical, behavioral health, and the things that just keep our bodies and our minds healthy. And in addition, we need to improve the systems around us and make sure that our system access is streamlined, hopefully seamless, and that we have removed barriers where people find them through their complexities, eligibility criteria, and all the paperwork, that we are ever working on making those systems a little more streamlined and a little more approachable. So these are the 5 strategy areas that the levy focuses on as things that we want to create and make strong in our community. It looks like someone might be trying to join us. One moment. Yes. Let's welcome the latest person, Laurel Kelso. I'm gonna ask you where you are, who you're with, and over here you should be able to see who else is on the line with us. What's your organization?
Hi, I'm with Navos.
Okay, and you can see here who's in the room with us. Ethan Soraka with Sound, Dee Lockman, Kathy Basion with Easter Seals, Cassandra Jackson with Sound, Joelle Blair with Sound, Parsh with Headstrong, Melissa Rowe with DVA, and yourself. I am in the moment right now of describing what the Veterans, Seniors, and Human Services Levy is. And the 5 strategy areas are. And this one is being RFP'd and funded through the Healthy Living Strategy. One of the guiding principles of the Veterans, Seniors, and Human Services, or actually the 3 guiding principles, are combined arms, foster belonging, and creating a community of service. The levy, given that it's been funded by the King County voters with an intentional focus on flexibility and doing those things that the levy can do, but other funding sources can't, perhaps state funding or federal funding, which has quite a few levels of complexity and eligibility criteria. The levy can be what we sometimes call the grout in between the tiles. It allows us to create a sense of, work on those programs that create a stronger sense of belonging, because most programs before have really only focused on the hard and dried aspects of programs. The levy can create the soft middle, the grout, the things that make the networks work better together. We focus on creating a combined arms approach, helping organizations one picks up where the other leaves off, so that collectively our system and our network and our safety net is functioning better. We intentionally focus and support and indeed require that all funding activities focus on equity and social justice to ensure that all people, regardless of who they are and where they live, have the opportunity to thrive with full and equal access to opportunities, power, and resources. We acknowledge that institutional racism occurs and is a fact in our nation and in our community, and we seek to dismantle those structural and systemic barriers that keep people from accessing the opportunities that help them become who they want to be and the resources and the support that they need to get there. All of our review processes and our support processes are about how do we help some of those with the most barriers step forward and gain access to what they need. Those particular questions will be in the RFP, asking you to state how your organization actively pursues those same goals, what you've learned from the processes, and how you are engaged in a process of continual learning and growth to achieve that, and how we can support you on that journey as well. Recognizing that many of you, as community-based organizations, are actually further ahead than we are at the county. But the good side of it is that now we can use the resources and the basis of the county to support more community growth towards that same goal. This particular strategy, HL1C and HL1D, is based, as I said, in the healthy living strategies of the Veteran Seniors and Human Services Levy. As I said, the levy is based into, or is broken apart into 5 different strategies. This one, Healthy Living, has several components. We want to both have prevention components. We want to provide care in the community. We want to ensure that we are reducing and eliminating abuse, assault, and violence. And we want families to be a place of growth and nurturing. So within each of these overarching themes, we have some very specific RFP areas and program result areas. This one particular is about veteran PTSD, MST, and end-of-life counseling, and military family counseling. The RFP, the strategy, contributes to the community-level effort to reduce the number of people who seek behavioral health care through emergency medical care or the crisis response system. This RFP, again, further recognizes that military service can cause or exacerbate behavioral health and wellness concerns among service members, and military service creates burdens that go beyond the service members themselves and also to their families. Families are there supporting their military members, their loved ones, through their service and afterwards. And oftentimes family members are not eligible for VA-funded counseling or other military-specific counseling that recognizes the impact and is culturally competent around military and veteran issues. So this RFP will fund an entity or entities who are subject matter experts in culturally competent counseling needs among veterans, service members, and their family members to create a system of high-quality counseling services throughout King County. It will ensure that each practitioner funded under this contract holds the appropriate education, training, experience, licensure, or credentials to practice in Washington State, that the counseling services are delivered in alignment with evidence-based, evidence-informed, and emerging practices for common diagnoses typical amongst veterans, service members, and military family members, that to the degree possible and appropriate, coordinate and align services with the VA, VA Choice, and private insurance, other counseling services to maximize counseling resources available to the individuals, compile, analyze, and report data, and create opportunities for networking and training among the clinicians, mental health professionals and peer support specialists, and recruit as possible, especially those counselors who are themselves veterans, who understand the concerns and needs of this client group, and also market the availability of the counseling services. These are pretty much the highlights of things that came out of the focused feedback groups that I sought and that I went, had many conversations to say what, at the end of the day, are some of the most important features that we need to make sure that this RFP is funding. Number one was the cultural competency of someone understanding, of the counselors understanding the importance of military experience and military culture. It is its own unique brand of cultural competency. And if you do not understand what someone's experience might have been like in the military and some of the common diagnoses and some of the better evidence-based processes to treat that, you can actually do harm. So this is going to be goal one, making sure that an organization strongly understands military culture and the military experience.
They were okay. I mean, there's more below if they're not good.
Okay, someone's not on mute at this point. And I'll ask you to go on mute for a minute unless it's a question specific to this, what I'm talking about right now. The other thing is, because I myself am not a licensed mental health practitioner, and so I am not appropriate nor eligible to supervise and manage the services that someone might be delivering under this. So what I require, or what our department requires, is that the entity who was funded to do this hold those credentials. So they will be responsible for coordinating a cohort of counselors and making sure that each counselor who is receiving reimbursement under this RFP has the appropriate education licensure to be and to sustain their credentials to practice in Washington State, and that they are guiding and supporting those counselors in understanding evidence-based practices and emerging practices, and that they are creating opportunities for those folks to network, to learn, to continue with their continuing education credits. And then at the end of the day, there's a fair amount of reporting that is required under the levy. So this entity will be compiling and reporting up the data under the client level data, although it could be anonymous due to HIPAA, but creating the infrastructure that it takes to oversee the entirety of this network. Any questions? This is perhaps the single most important slide in the deck. Any questions before I move on from it? Let me see if I see anyone going off mute. Oh.
I had a quick question around credentialing. Is this credentialing as far as what it takes to practice within the state of Washington, or is this specific to credentialing for reimbursement under like Medicare and VA benefits? Meaning, because you can be credentialed as like an agency-affiliated counselor or a sub counselor, and those typically aren't reimbursed by those formats versus a licensed MSW, which is reimbursable by, or a licensed mental health professional, which is reimbursable from some of those other funding sources.
You're right. First and foremost, the primary is licensed simply to provide counseling services in Washington State, which would then make you eligible for reimbursement from this funding stream. But we also want to, as possible, maximize the number of counselors who are also eligible to invoice under Medicaid, Medicare, VA Choice, because it can occur that we want to help people maximize their counseling resources. I believe like VA Choice has a maximum or guidelines towards about 8 sessions, maybe 8 to 12, I forget exactly. And at that point, if that has been the resource you've been using, but you would benefit from additional therapy and you've maxed out of that, well, then you can transition to this. So it's the benefits to the veteran is that they have multiple options. So we want to maximize that as possible, but the requirement is that you have the licensure in Washington State to be a counselor. Did that answer that?
It did, thank you.
Okay, and give me a moment while I type that in, because I will want to make sure that I've recorded that for others who might be viewing this afterwards and can benefit from the same answer. I'm going to take a shorthand note here. And you'll see me do typos along the way. Okay. Any other questions before I move on to this next slide then?
Yes, this is Kathy Basalin from Easter Seals, Washington. So I'll just be transparent. We are credentialed to do a number of services in the state. I don't know that we're currently credentialed to have mental health counselors. We do behavior health and some other things. If we had a plan to quickly get there and we had support from other Easter Seals affiliates who have that status, could we still be in the running?
You are definitely eligible to apply. You will There is a question, then you'll see in the narrative questions, what would be your plan to quickly gain those skills and become competent? Because as we said, first and foremost, this is a necessary thing that you be culturally competent in providing counseling services to veterans, service members, and their families, or the demonstrated ability to quickly gain that competency verified through a really strong implementation plan.
Okay, and I think we could do that because we've done some other things with veterans and family coaching through Operation Family Caregiver. So I think we could demonstrate that.
Okay, let's see, credentialed. Let's see, let me see, question. Okay, Kathy, does that answer your question here? Are you able to read what I'm writing here?
Yeah, that's perfect. And I'm going to stay on the call because I think I'm still in the running here. So thank you.
I see two people here now who are guests. Do you want to introduce yourselves? This guest here? No? If you want to be silent, that's okay. How about this guest here? Anyone else want to introduce themselves? Okay. Oh, we've got now Peter. Okay. Hello, Peter. You can see over here who is joining us on this call, minus some folks who have chosen to remain silent. We are going.
Thank you.
We're going through the slide deck, and I've just explained that this is perhaps the most important slide explaining what we are seeking to procure and why. The most important thing being those who are culturally competent in providing behavioral health and wellness to veterans, military service members, and their families. And because I myself do not hold the licensure and credentials to oversee people who are providing counseling, having a head organization who makes sure that each of the counselors who is reimbursed through this funding stream has the appropriate education and licensure, and that they sustain that, that to the degree possible, that they are aligned with other resources that can maximize the counseling options to the veterans, and that they create opportunities for networking and training amongst the clinicians, including their CEUs, and market the availability of counseling so that veterans throughout King County who may not know about it or may be resistant to seeking it will make that first step of accessing it, and including making sure that some of the services are available and funded and recognizable to families, because family members serve alongside their veteran members as they support their folks being off in the service. The next one slide here is the available funding. There is up to $2.56 million available through December 31st, 2023. It is spread out over each of the years. And you can see here the funding that eventually, what we do in King County is we contract on a 2-year biennium basis. So we are right now in the midst of a biennium contract period that goes through December 31st, 2020. After that, the successful applicants and contracted partners would get another 2-year contract that would go from 2021 to 2022. And then depending upon amount awarded, this amount or portion of it. And then in 2023, even though it's a 2-year funding period, it would be a 1-year contract while we await placing the levy on the ballot and seeking the King County voter approval once again. This RFP eligibility for application is open to nonprofit organizations, community-based organizations, tribes, tribal organizations, and public or government agencies who serve or will serve veterans, military service members, and their families in King County. They must be licensed in Washington State to coordinate and supervise licensed and certified behavioral health practitioners, peer support specialists. They must have demonstrated cultural competency or an ability and a willingness to gain that cultural competency on issues of military service and military culture. They must be informed of evidence-based, evidence-informed, and emergent practices around PTSD and other military service-related trauma, such as military sexual trauma, TBI, traumatic brain injury, PTSD, of course. And we are also finding that end-of-life concerns. We've got the majority of veterans in King County, and indeed nationwide, are older veterans, back at the time when military service was part of a draft, not the voluntary service that it is now. The biggest cohort of veterans are those who served during the Vietnam War and earlier. And what they are now facing is some end-of-life concerns, and their military service, things that they may not have addressed earlier in their life. Now that they have time on their hands, is coming back, and they can benefit from putting that into perspective and finding healthy ways to address it. So we do have a specific intention and opening in this strategy to make sure that counselors are also aware of that and can help the veterans process that. The other thing is that we seek someone or an organization who has the demonstrated experience or ability to learn to coordinate services with the VA, VA Choice, and other healthcare systems, again, to maximize choices and opportunities to the veterans. The contract requirements for this, we've mentioned, or I mentioned before, the combined arms element. And that is part of that system alignment and improvement, but making sure that we are working together to connect the veterans to the resources, to the services, and to other networks that can benefit them. So what we would seek is that each partner with this becomes knowledgeable about the King County Veterans Program and make sure that every veteran that you see, that you share that information about them. The King County Veterans Program has 2 offices, one in Seattle, one in Tukwila, and it is a resource where people can find out about employment programs, flexible financial assistance. That's important here during this time of COVID. There's rental assistance, mortgage assistance. We can help folks get into figure out how to use their GI Bill for those who are newly returning veterans. It's just a place that when folks need a little bit of hand-holding to solve some of the common bureaucratic challenges of day-to-day life and reintegration into civilian world, the case managers at the King County Veterans Program can help people navigate those steps. So what we want to do is partner with someone who will join us in this combined arms effort and make sure that we are networking with each other to do all the community supports that someone might need. We also have, as you saw earlier, there's about 60 million that's being generated from this levy, so 20 million per funding stream. With that 20 million, we are funding quite a few other strategies. We have some outreach strategies. We have some social engagement strategies. We'll ask that the counselors be nominally familiar in those so that as you're talking with a veteran or family member, you can inform them of the other opportunities to access resources and supports through the levy and through the King County Veterans Program. We'll ask that you stay engaged with us to help us learn from you. What are the trends that you're seeing? What are the things that you think need to be addressed in policy planning, system alignment? And how can we stay on track with each other through continuous quality improvement? How can you keep me informed so that I'm supporting partners to provide the best services? We really are approaching the entirety of the levy and our partnerships as joint learning and want to stay in frequent and transparent communication with you to sustain those networks. The other contract requirements of a successful applicant and contractor is that there are quite a few requirements in our King County boilerplate. It requires that you be an equal employment opportunity, that you did not discriminate based on, the protected classes, that there are record-keeping requirements on retention, public record disclosure, I know that recently there's been an addition that you have an emergency management plan. So what happens and what would your organization do when you're hit with something like an earthquake or this, shelter in place opportunity, or not opportunity, but shelter in place requirements? How would your agency sustain operations and stay in communication with that? Those are some of the components of a King County boilerplate, and that exists in the RFP as an attachment. So you'd be able to peruse those and understand those. There's also will be the program exhibit, and that will be the detailed scope of work that is we would negotiate together at the end of the conclusion of this RFP, but essentially what it does is it brings forth the same requirements from the RFP into a contract saying, now that you've applied to do this, now let's put it into writing about that you will do this and how we'll hold each other mutually accountable for me to provide the technical assistance that you might need and you to provide the services that you've said you'll deliver. Another contract requirement is an upholding and sustaining, bringing forth the principles of equity and social justice, evaluation and data collection and reporting, that you participate in the network of services and service coordination meetings and trainings that we might hold. We are also conducting wage surveys because we recognize that very often these very important services are provided at the cost to provide some of these most important services in the community sometimes are on the backs of the service providers themselves. Wages are low, and we want to understand how does that affect the provision of services? How does that affect retention, quality of life, and job satisfaction for the people who are actually providing the services? How can we understand that to create a better system and structure for the providers so that they can stay in their jobs and provide the best services that they have without themselves being stressed out about their cost of living and how to afford to live in King County. We also will be doing an annual, biannual client satisfaction survey to understand opportunities to reduce barriers and enhance services at a system level. That is still being developed, and so the time to implement that is sometime much later this year, perhaps even next year. But when that is developed, we will expect partners to participate with us in implementing that. Same with the wage survey. It is in development right now, so it will be sometime next year when we actually get to that. But when we do, partners will be expected to help us implement it. This RFP timeline, it was released last Tuesday. Today is the bidders conference. It will be open for 4 weeks with responses due by June 16th. If you have additional questions, such as what might come up in a frequently asked question, sort of like what we have over here, what we do is we ask that you submit those through ZoomGRANTS, and in the subject line, start with FAQ so that I can make sure that I receive those, see those, and I can type them up and post them in frequently asked questions into ZoomGRANTS. In that way, all participants or all applicants can benefit from hearing the same questions and learning from this consistent answers, and no one has benefit over the other. That's the other thing to know, is that we are what we now call a blackout period of communication. I am not allowed to discuss or have conversations with anyone individually during this time. All conversations must be, quote, collective so that everyone can benefit from the same information. That's why we communicate through these FAQs at this point. So with proposals due on June 16th, they will be reviewed by a panel who will include community members, constituents, or those typical clients, subject matter experts, other planners like myself. Then we would make our recommendations to our leadership and decision team and our county council members with responses and notification in mid-July. If we determine that interviews will be necessary, we would conduct those in early April. We anticipate beginning to negotiate contracts by the end of July so that services can begin on August 3rd. One thing that I want to say about submitting an application and making it compelling is that know that the planning and the implementation plan and the scoping of this RFP was really conscientiously informed by community input. And so when it comes to answering the questions in the narrative questions, you do not need to expound on why these services are needed or feel like you need to give compelling answers about why this needs to be done. We've made that case for you. What you can focus on is giving a succinct, concise, and compelling answer of how you are the one who's best situated to provide the services based on what's been laid out of what's needed. I hope that's helpful, because having been someone who's worked for a nonprofit and written a number of grant applications myself, I spent a lot of time making the case for providing the services. As I'm saying, we already have that case made. Now you just need to make the case for you to be the provider of those services. There will be some summary questions that are required. Those are just basic questions of what's your organizational size, what's your agency budget, where are your offices located, and which geographic areas do you intend to serve. An important thing to note here is that if your services will be eligible to anyone who resides anywhere in King County, as in, say you have a practitioner in Auburn, but if someone who's living in Shoreline is willing to travel to Auburn to see that counselor, then you should give yourself credit for serving both geographic areas. Sometimes people too rigorously say, well, my office is in Auburn, I'm only going to be serving Auburn people. That is the geographic location, but it's not necessarily the intent to serve. If people are willing to travel and go there, and you would allow that person to access the services, then make sure that you make note of that it's about where people can choose to go, not that they're limited to go. There are also some narrative questions that I'll get into in just a bit, and then we ask that you also include a budget. The RFP is scored and scoped around some basic themes. Tell us about your organization. Tell us about your experience providing counseling services, and specifically to veterans, military service members, and their families, and how you can make the case for the cultural competency or ability to gain that quickly. Tell us about how you will actually provide those counseling services, and the models that you choose, and the type of practitioners that you would be supporting. Your focus and your adherence to the principles of equity and social justice, your ability to manage data and report on client success, your ability and willingness to act in partnership and collaboration, and then finally the budget, so that we can show that the majority of dollars are going to go towards the counseling services that this RFP seeks to provide. I did note that we have panel reviews members based on community service or community members, those who would be likely to participate in this kind of counseling, other planners like myself, subject matter experts in counseling and in military culture. But we also are happy to receive referrals from people who you think would like to be a part and being on this panel. It will be Skype based, but I'm sure that there are people that I don't know who would be excellent panel members, and I welcome you to refer those to me, acknowledging that we can't have any conflict of interest. If this person works for your organization and your organization is applying, well then of course they couldn't serve on the panel, but other community members who you know, please get them in touch with me. I'm going to go into ZoomGrants quickly and show you how, oops, this is a typo. I'll fix that as I post this to the web page. But we're going to go to ZoomGrants. I'm going to walk you through how to do a ZoomGrants application quickly. And then here, please make note of my email. Any questions, you can contact me, although know that I won't be able to respond directly. I'll have to turn that into an FAQ. Any questions on this slide deck before I get into walking you through ZoomGrants and the narrative questions? No? Okay, let's get to ZoomGrants. So, in ZoomGrants, oh, actually, you know what? The first thing I want to do is walk you through the narrative questions. That's important. The narrative questions are, very much reconfigured word for word in ZoomGrants, but sometimes it's easiest to see the narrative questions here. We ask that you give a 2 to 3 sentence elevator speech of your program. This is so that if you are, one, it helps the panel members to understand quickly what it is that you're seeking to do, so that as they begin to review more deeply your answers, they've kind of oriented themselves to what to expect and how to interpret everything that follows. Then, as I said, we ask you to tell us about your organizational mission and history, the things that make you, like who you are and what makes you a leader in the field, your experience and knowledge of providing counselings to veterans, military service, or the ability to gain that quickly, your ability to provide counseling and the administrative and programmatic aspects of overseeing this type of service. Again, the program design, the equity and social justice. I do over here give note of the amount of characters and the words approximation. Again, this is to guide you towards being concise and focused rather than feeling like you need to provide a compelling narrative of why. It makes it easier for the panel members to really hone in on the essence of what it is that you're proposing to do. So there are going to be some character and word limitations. I find that it's easiest to answer these separately in a Word document and then cut and paste into ZoomGrants, because the viewing screen size in ZoomGrants is limited. So you'll, and because you can do word count and character count in Word. I think up here, here's word count in the review toolbar, if you are doing that. Now let's go to ZoomGrants. And I'm going to log in, not as I have to log in as my other avatar. This one brings me in as the programmer, not the applicant, but I can't seem to find the place to log. Oh, there we are. Okay. Okay, so you would go and find the RFPs that you're interested in. This case, the Veteran and Military Family Counseling. Here's where you could read the general information on it, the application. Oh, let's see, the dash programs. Excuse me as you learn with me, or excuse me. Gosh darn it. I've forgotten how to do this from this side. Summary questions. This is. Has anyone tried to get in and faced this same issue?
Have not.
I can't even find. I don't know if it's my learning that I haven't done this in the last 6 months, or if there's something here that's applications. Oh! That's because I'm in here as a panel member. Okay, remember how I said you needed to have different avatars to get in here? I needed to go in as my Hotmail account. I apologize, folks. I have 3 profiles in ZoomGrants, one as an administrator, one as a panel member, and one as a typical applicant. And I was going in as the wrong one. So I want to find this application or this RFP. There it is. Okay, so this is going to tell you about this RFP and the basics of it. A lot of the things that we've already discussed. As you get down here, you're going to see the library. You would be able to open up and see the RFP in and of itself. You open this up and see the summary questions. Open, allow. This is, you're not actually going to answer this in Word. This is just telling you the sorts of things that are there existing in ZoomGrants where you answer in ZoomGrants. So I'm going to exit out of this and show it to you in ZoomGrants. Here's the summary questions. This is where you would be answering them. The first name, last name of your AD. You'd hit next. Then you'd be getting into how would this funding support your organization? What's your organization size? How many FTE do you have? We have what we call technical assistance and capacity building funds. If there is one-time startup costs that would help you create and grow your infrastructure to better provide these services, then that is an ask that you can make. It is only available to organizations who have less than 20 FTE and an annual operating budget of $4 million. The reason for that size limitation is because this is about growing the organizational capacity of smaller organizations so that they can gain the infrastructure, gain the support. We do find that sometimes the smaller organizations can be those who are closer to the needs of folks, but sometimes they need capacity development and say, creating accounting systems or database systems. This is some place where where an organization could request capacity building funds to do that. Then when we get to, let's see if it has brought us, okay, then we're here to the narrative questions. Remember I showed you the Word document of each of the narrative questions. Here they are programmed into the actual ZoomGrants. As you can see here, the space that you can see what you've written is pretty limited. So this is why sometimes it's easier to work in Word and then copy your information over here. And this will tell you the character limits that you're having. And as you're getting closer, as you are running out of space, let me see, it seems to be not letting me actually get in. But anyway, as you are using up your characters, this countdown here will be lowering so that you'll know that you're getting close to the amount of characters that you have to answer. One of the things that is also, there's 20 questions or so. Yep. Next. And then one of the things that's required is completing the organizational equity chart. This helps us understand how your leadership body, staff, practitioners, and board members might be reflective of the people that you plan to serve. Again, that helps us be better aligned towards the services that we're providing and that we are all working towards those goals of equity and social justice, that the services and our leadership and our personal organization reflects what we are doing in the community and who we are serving in the community. There's a budget, and the way that you would do that is open up the budget form, open, and then there's an upload tab. You start here in the personnel. Tell us about the staff who will be involved in overseeing and administering this project, this contract that you might have, and how you might be breaking out the funding for the veteran counseling and the family counseling. If you are proposing to do both, you could have both here. Here's an example over here of what my ABC agency might have filled it out. And then over here is the line item budget. And recognizing that the majority of the dollars should be going towards the actual psychologists, social workers, peer support specialists that you might be contracting with, subcontracting with, or employing to provide the services, all coming up to, the total budget amount in this case, anticipating that someone might apply for all of the funding. Later, as you get to, I'm looking for the required, oh, yes, here is where you would upload. You would download the budget, finish it up, and then upload it, save it to your computer, and then upload it over here on this button. That's a quick primer on using ZOOMGRANTS. Any questions from that?
Yes, this is Kathy.
Uh-huh.
I'm just confirming what you just said. We can contract with the counselors. We don't have to hire them as employees.
That is correct.
Thank you.
Okay. But then what you'll see that one of the narrative questions does ask, what is your program model, your counseling model? How did you land upon that? What would be your reimbursement rates? So that's where you can explain that would be your model for how you deliver the services.
Gretchen, there was a question about, I got a question about peer support.
Uh-huh.
So I may be misunderstanding. I thought licensed mental health was the focus point or delivery of service. Peer support is also?
Peer support is an eligible activity. A credentialed peer support specialist, because they can be credentialed through Washington State. There is such a thing. And so this was one of those things as we did community feedback. There were some really compelling statements about the value of peer support specialists. So if your program model includes that, make the case for it, describe how it would work, include that in your model.
Thank you.
Mm-hmm. But there is, okay, as you say that, one of the things to note, and this is laid out in the RFP, this still does focus on the counseling or the behavioral wellness aspects of PTSD, end of life, and family counseling. So, like sometimes folks might be doing PTSD treatment through wilderness retreats. This funding wouldn't be for something like that. It is based on, something that is really more actively connected and aligned with a counseling mode of service. I'm going to go back to the PowerPoint. We are at questions. We've done the ZOOMGRANTS. We looked at the narrative questions. One thing, if folks want to really understand the context of this RFP through the overall levy, there is a 194-page Word document that you could look at to understand that entire contextual understanding, and you could find this by Googling Veteran Seniors and Human Services Levy Implementation Plan Attachment A, and this is what you would be able to call up. But it's a deep read, but I do want to let you know that that's there in case you're trying to understand the full context of it. The other things that I wanted to make sure that I covered today was looking at the RFP, which we did, the questions. I think I've covered everything that I went into this presentation knowing I wanted to cover. Again, I'll offer it up for one last round of questions, or I'll leave you to it, knowing that I will be posting this Bidders Conference to the Library of ZoomGrants by the end of today after Skype is done processing and packaging it, and that the rest of the communication can occur through FAQ, reminding you that the deadline for submitting questions is June 9th, and that the deadline for submitting your applications is June 16th. One last opportunity to ask questions.
Hi, it's Kathy again.
Hi, Kathy.
Could more than one organization partner and collaborate?
Oh, yes. Uh-huh.
Okay. So we would just articulate that in our model?
Yes.
Okay. Thank you.
Okay. Thank you for joining me. I wish you well through what we are all experiencing right now with COVID-19 and a new way of doing business. You'll note that one of the questions there in the narrative is, how might you use emerging technologies such as telehealth? Because while that might not have occurred to us 4 years prior, it's definitely occurring to us now. So we wish you well. We'll be in touch, and thanks for participating in today's conversation.